TennCare and UnitedHealthcare Community Plan operate with an illegally inadequate and discriminatory provider network. This inadequate network prevents people with jaw and airway-related disabilities from receiving the care they require to be rehabilitated, which violates Medicaid law. This makes the entire health plan discriminatory against people with jaw and airway-related disabilities, which violates anti-discrimination laws. Many chronic physical and mental diseases are caused by jaw and airway disabilities. Many people with those diseases do not know they have jaw and airway disabilities due to the inadequate discriminatory provider network preventing diagnosis. The evidence that this is the case can be found in a variety of sources, such as this continuing education course for dentists produced by Jamison Spencer Study Club.
So for a little bit more about getting paid, and particularly on the dental sleep medicine side, frankly for TMD, it's basically not covered in any state. And anyone who tells you that it is covered, be a little bit skeptical. If they tell you, yeah, we're using these treatment codes, Google the treatment code, read what it actually says it is, and think to yourself, is that actually what I'm doing? I bet you aren't. So I asked my friend Erica Johannes to do a video for me here for us to put in to talk to you a little bit more about getting paid. So let me pass the baton now to Erica.
So I hear reasons and excuses all the time about why people can't be successful in dental sleep medicine. And the number one reason I hear is because I can't get paid. I can't work with insurance. It's too hard. So let's solve that problem right now. Let's talk about how to get paid for oral appliance therapy and stay out of jail while doing it. We all have a need to get paid. If there's no money, there's no mission. You don't get paid, you can't keep your office open. You can't help people. But beyond that, we all have reasons we need to get paid too. These are my reasons. Fun fact, marching band and color guard are really expensive. They're great, but they're expensive. And that furry guy in the middle, he eats a lot. So I have to keep him fed as well. Those are my whys, why I need to get paid. That dabbling in the middle is a very dangerous gray area to be. And in reality, it doesn't exist. Okay. If you participate at all, if you give someone a code, you do anything, you're all in. You are playing the insurance game. There's no partial in. This is not the hokey pokey. I put one arm in, put one arm out. Nope. This is your whole self in, your whole self out. If you are in the middle, you look ridiculous. Okay, and you might get in trouble. So you are all out. This is what insurance do you take? I take Visa, MasterCard, and cash. Okay, or I am all in. And in the all in variety is when we're in network, out of network. We are giving patients codes at all. You are playing the insurance game. Next level, Medicaid. This is generally for the poorer population. Sometimes it's in conjunction with another insurance for parents or family members of somebody with a disability, the caretaker to the disabled child. But it is mostly a no-go zone. In most states, it is not covered at all. The states where it is covered, good luck getting paid. They'll say they cover it, and then you never get the check. So in general, we're going to say Medicaid doesn't pay. There are exceptions to every rule. Okay, rules don't exist without exceptions, but no, this is not. We're going to call this dairy-free, mochi, green tea, halo top. I don't know what's more disturbing, the fact that it exists or the fact I've tried it, but it's terrible. Just say no. Then we have private plans. These are, a lot of times I find these private payers where an employer made up their own insurance company. I see them a lot with insurance companies. So somebody who's a car insurance company or a homeowner's insurance, they will say, oh, we don't do the insurance game. We know this. We got this. And then they make their own plan. Yeah. Also not great because it's one lady or one dude for the whole company for nationwide who are answering the phone calls or doing the benefits. They may never even heard of oral appliance therapy before. So some of them are great. Some of them are not. We're going to call this rainbow sherbet because we don't really know what you're going to get. This one is a plan that you're going to want to do a lot of investigation ahead of time to make sure that you know and understand what they're going to do. If you're dealing with commercial insurance and you get it wrong, they're going to slap you on the wrist and ask for all their money back. Now, if you've already spent that money, that's a problem because you got to find a way to pay it back. But where it's really a problem is if you're dealing with a federal insurance, Medicare, TRICARE, the VA, anything that is federally run, then not only do you have to get your money back. You may lose your license and you may do jail time.